So my name's Crispin Chomba from MobiSAfAIDS. I'm the head of country program strategic evidence as well as country business. And we'll be presenting on behalf of MobiSAfAIDS on the digital technology that integrates social accountability monitoring into uptake of service provision, that is sexual reproductive health service provision. And we'll be sharing in terms of the lessons that we have learned. Just to say that MobiSAfAIDS is the regional organization and we are operating in the SADC region. And in this SADC region, we have piloted and implemented the mobile application, which is called MobiSAfAIDS. So the name is MobiSAfAIDS, which integrates technology into social accountability for sexual reproductive health services. Just briefly, what is the MobiSAfAIDS as a system or as an application? So MobiSAfAIDS is a new innovation and you can access it on the web, but you can also access it on Android. It seeks to strengthen accountability for service providers in the provision of sexual and reproductive health services through digital citizen engagement. There are some unique features that I just want to highlight here about the MobiSAfAIDS application. First of all, it is a social accountability monitoring tool for adolescents and young people, and it offers real-time data and evidence that can be used for advocacy for provision and uptake of sexual reproductive health services, which is quality, comprehensive, integrated, and of course, non-judgmental. It provides a two-way communication between the service provider and of course the adolescents and young people. And when we're talking about adolescents and young people, we do acknowledge that there are different adolescents and young people, those that identify themselves as LGBTQI, those that are sex workers, those that live with HIV, the adolescents and the adolescent mothers, and of course the young women as well. Those are able to use this particular platform in the region. We piloted this in 6 countries, that is Zambia, Zimbabwe, Eswatini, Malawi, South Africa, as well as Lesotho. But of course, we have seen that we have scaled this up from the time that we piloted it to reach to many facilities which were not initially targeted. And we'll, in a second, just try to walk you through how it works. How does it work? So in the countries where we're working, we have trained the young people as champions, who we call the social accountability monitoring youth champion for SRHR in the facilities where we have where we are working. And these are the champions that will in turn mobilize other young people and raise a sense of urgency for other young people to be using the MobiSAfAIDS application. So what happens is this, that when the adolescents and young person goes to a health facility and they experience a challenge, they then report this barrier to accessing SRH services through a ticketing mechanism. So the barrier that they raise is raised in the system as a ticket. This ticket is captured in the system by the administrator or the manager of the facility, and who analyzes the issue that has been raised, and or assign this issue to a particular service provider that needs to be addressed if this issue has to be addressed at a health facility. The system will then capture the information and inform the relevant health service provider of the new ticket. And at the same time, it will notify the user, who is the young person, through a phone that the ticket has been assigned to this particular service provider. And when the service provider resolves this particular challenge or this particular barrier, it is then marked as resolved. At that, however, all that I was talking about, let's see if we can just capture that in a video. Let's see if the video would show, so that all that information that I was sharing will be contained in this video as well.
This is Lisa. She has just left the clinic without getting the sexual and reproductive health SRH service she needs. Lisa is like a lot of us young people. We are extremely affected by lack of youth-friendly SRH services in our health facilities. These services are required of our governments to provide them. Governments are obliged to effectively deliver public sexual and reproductive health services which progressively realize people's rights. Not being able to access SR8 services is a violation of the right to health. Citizens should hold the government and policymakers accountable for obligations towards realization of human rights. We call this social accountability monitoring, or SAM. With SAM in mind, SAFAIDS is running the MobiSAfAIDS app to empower young people like Lisa to hold policymakers in their communities and countries accountable towards delivery of youth-friendly SRA services. To use the MobiSAfAIDS app, you need an internet connection. After downloading the app from the Play Store, select Register for an Account option on the opening screen. Thereafter, you will be taken to the MobiSAfAIDS page, where you will scroll down and fill in your information under New User Registration. At this point, you can choose a nickname as your username if you wish to remain anonymous. After filling in your information, click the Register button. You will receive a notification that a MobiSAfAIDS System Administrator will activate your account. Once your account has been activated, you will now be able to log in and use the app. Submitting an issue is simple. Log back into the MobiSAfAIDS app by filling in your username and password. Once you are logged in, click on the red button at the bottom right of the screen to create a ticket and fill in the required information from the drop-down menus, as well as a brief description of your issue, and your ticket will be ready for submission. Click the green button to submit. Your ticket will be saved, and you will have the option of adding any extra details such as your picture, voice note, or video. Thereafter, you will be given a ticket number as well as a summary of your issue, including its status. Our system will capture information and inform the relevant healthcare facility admin of this new ticket. The healthcare facility admin will assign the ticket to a healthcare service provider to address. Our system will notify you that the ticket has been assigned, and the responsibility will be on the service provider to resolve the SRH service issue, marking it as resolved once it has been addressed. Our system will notify both you and the healthcare facility admin that the service provider has resolved the issue. With the issue marked as resolved, you will now be able to close the ticket. If the issue has not been resolved satisfactorily, you can mark the ticket as unresolved. The healthcare facility admin will follow up with the healthcare service provider to address this issue further. Apart from you and the healthcare facility staff, the data from the MobiSAfAIDS is accessible to other stakeholders who will support young people to demand accountability from the state. By linking young people, youth-led CSOs, ward councillors, Ministry of Health officials, local MPs, healthcare facility administrators, healthcare service providers, SAFAIDS country-level administrators, and SAFAIDS oversight administrators, the MobiSAfAIDS is designed to strengthen accountability of healthcare service providers in delivering youth-friendly SRH services through digital citizen engagement. And don't worry, if you get stuck at any point, our friendly SAFAIDS SAM for SRHR champions and local organizations will be available to help. MobiSAfAIDS was created by MobiSAM, Department of Information.
So thank you. Let me pause here and just ask if participants have got questions or comments. In the minutes that are remaining. Suffice to say, we have about 23,300 plus adolescents and young people that are using this application. And in some of the countries, we've seen government interest to scale up this application to be used in their health facilities. And we see that this is a sustainable initiative as well.